Janumet contains a combination of metformin and sitagliptin. Metformin and sitagliptin are oral diabetes medicines that help control blood sugar levels. Metformin works by decreasing glucose sugar production in the liver and decreasing absorption of glucose by the intestines. Sitagliptin works by regulating the levels of insulin your body produced after eating. Janumet is used together with diet and exercise to improve blood sugar control in adults with type 2 diabetes mellitus. Janumet is not used to treat type 1 diabetes. How to use. Recommended dosing. Take Janumet orally twice daily with meals. Individualize the dosage of Janumet on the basis of the patient's current regimen, effectiveness, and tolerability. The maximum recommended daily dose is 100 mg of sitagliptin and 2000 mg of metformin hydrochloride. Do not split or divide Janumet tablets. The recommended starting dose in patients not currently treated with metformin is 50 mg sitagliptin and 500 mg metformin hydrochloride twice daily, with gradual dose escalation recommended to reduce gastrointestinal side effects associated with metformin. The starting dose in patients already treated with metformin should provide sitagliptin doses as 50 mg twice daily, 100 mg total daily dose, and the dose of metformin already being taken. For patients taking metformin hydrochloride 850 mg twice daily, the recommended starting dose of Janumet is 50 mg sitagliptin and 1000 mg metformin hydrochloride twice daily. Contraindications. Janumet is contraindicated in patients with severe renal impairment, acute or chronic metabolic acidosis, including diabetic ketoacidosis, history of a serious hypersensitivity reaction to Janumet, sitagliptin, or metformin, such as anaphylaxis or angioedema. Warnings. You should not use Janumet if you have severe kidney disease or diabetic ketoacidosis. Call a doctor for treatment with insulin. Janumet may cause a serious condition called lactic acidosis. Get emergency medical help if you have even mild symptoms such as muscle pain or weakness, numbed or cold feeling in your arms and legs, trouble breathing, stomach pain, nausea with vomiting, slow or uneven heart rate, dizziness or feeling very weak or tired. Janumet may also lead to a serious condition called pancreatitis. Call a doctor right away if you have severe stomach pains with or without vomiting. Side effects. Common side effects of Janumet include nausea, vomiting, stomach upset, diarrhea, constipation, headache, weakness, back pain, joint or muscle pain, a metallic taste in your mouth, or cold symptoms such as runny or stuffy nose, sneezing, and sore throat. Janumet does not usually cause low blood sugar, hypoglycemia. Low blood sugar may occur if Janumet is prescribed with other anti-diabetic medications. Symptoms of low blood sugar include sudden sweating, shaking, fast heart rate, hunger, blurred vision, dizziness or tingling hands, fear.